All right, welcome everyone to Speak, Sessions Promoting Education, Advocacy, and Knowledge. We're super excited today to welcome Dr. Lina Patel. She's going to be presenting about potty training workshop, Lose the Diapers, Not Your Patients. This has been one of our most popular workshops with the most registration that we've had. So if everyone will please mute your microphone so that there's no background noise, and then I'll make Dr. Patel the co-host. All right, you should be good to go.
Okay, just gonna share my PowerPoint. One second. Okay, are you guys seeing the intro slide?
Yes.
Perfect, perfect. Okay, so as Whitney shared, my name is Dr. Lina Patel. I have had the privilege of working with kiddos with Down syndrome now for over a decade and a half. And I worked with kids as young as, a year old and as old as into, late adulthood. Um, Potty training obviously is like a big heavy hitter topic. And what I will say is that the strategies that I have that I'll be describing in this presentation really are ones you can use across the lifespan. What I will tell you is that I probably see a skewed population of kids with Down syndrome who have had a difficulty with becoming potty trained. And so that doesn't mean that traditional, methods don't work, but given the neurodevelopmental profile of kids with Down syndrome, the strategies that I'm going to talk to you about or how to kind of go about it is really very much related to what I've learned over that course of time. So I'm going to dive right into chatting a little bit about kind of what I've learned and to share with you a little bit of background also about how I developed some of these strategies specifically for the kids with Down syndrome with whom I work. I will say I do clinical care at Children's Hospital Colorado, and then I also do research at the Cernic Institute for Down syndrome. And so my, goal is to really help across both, scopes to be able to think about intervention in a more critical way. Okay, so when I don't know if any of you guys have done this recently, but if you do a Google search for toilet training, you see that there are lots and lots of results. That can be quite overwhelming when you think about, how can I apply this to my loved one that I'm working with on toilet training as well. If you add in the, toilet training and Down syndrome, you'll see that there are still quite a few results. Now, I can't say that, all of these web pages or these search results are, evidence-based, meaning like somebody has done research. Some of these are, people's personal experiences, which is fine as well. But really, what I like to think about is over the course of time that I've worked with individuals with Down syndrome, what are the strategies that I have found that have been most effective? And then also asking our families, like, what are the strategies that have been most effective? So while we can certainly go to Google and search for these results, what I find is much more helpful is thinking about it from an evidence-based standpoint. So I'm just going to go through a couple of the different types of like overall methods of toilet training, and then I'm going to specifically land on the one that I tend to share with families. And I will tell you that I had sent Whitney a PDF of all of these slides so that you guys can have them for reference at a later point in time. Hang on one second. I'm so sorry. I'm just going to log out of my Teams, otherwise it's going to keep dinging during the presentation. So the first one I'm going to talk about is child-oriented potty training. So child-oriented potty training is really starting at a really young age, and so between 2 and 3 years old, and really being able to kind of focus on how the child is, when the child is ready to actually become potty trained. So this is like when parents aren't in, a big rush, but really are kind of taking cues from the child to begin the toilet training process. While this is a completely appropriate approach and, is the one that's taught the most, for the general population, what I will say is that for our kids, a lot of times this can actually result in some other more challenging behaviors coming up at a later point in time if we wait too long for readiness skills in particular to become a parent. So child-oriented potty training is absolutely an appropriate approach for some kids. The kids that I've worked with, this hasn't been super duper successful, primarily because our kids are just navigating a lot of different milestones. And so what we sometimes will see is that potty training without kind of a clear understanding of what the person is wanting us to do may make it a little bit more difficult to actually implement this. The next one is kind of what people will call like boot camp, right? So 3-day potty training. I don't know if any of you guys have heard of this, but what the evidence for this shows is that you should be doing this, when your child is approximately 22 months, so even less than 2 years of age, and it's really kind of like this, take a day where the diapers are gone and you really kind of let the child understand that, oh, they're having an accident. It's really meant to be able to help the child to feel that the urine or the poop is coming out. And so the idea is to help kids to quickly be able to develop this skill around then going to the bathroom instead. What I will say is that while this is, again, another appropriate method that people have used, and there's evidence, there's research evidence that shows that it's effective, what I will tell you is that most of our families get pretty frustrated with this method because the length of time that our kids take in order to kind of learn this idea of listening to your body takes a little longer. And so a lot of our families just really can't tolerate that aspect of waiting that long and experiencing that many accidents before the child starts to kind of really recognize that what's happening in their body. So again, not a bad method, but just one that a lot of times our families can get a little bit frustrated with. Hey, Whitney, did you make me a co-host or just the host?
I think just the host.
Okay, sorry, there's a bunch of people in the waiting room, so I just let them in.
Oh, sorry.
No, that's okay. So the next one is a parent-led potty training method. This is the one that I really tend to lean towards. It's really about helping kids to understand that there's lots of different components to toilet training. And so you may have heard kind of like putting a child on a schedule and taking them, early, kind of at routine times during the day. The interesting thing is that the definition according to Healthline is that you have to wait for a child to show all of the readiness skills, which I'm going to share with you in a moment. But I actually say, no, you don't need to. If you wait for all the readiness skills, like, the physical, the cognitive, the behavioral skills to be a parent before you start toilet training, our kids are just going to be quite a bit older. And unfortunately, because our kids can kind of get into these grooves where they get stuck doing something a certain way and then have a harder time shifting gears, what we ultimately end up doing if we wait for all of the readiness skills to be acquired is that our kids are older and they have been in pull-ups or diapers for such a long time that trying to get them to stop wanting to use a pull-up or diaper becomes a little bit more challenging. So it's kind of a modified version. There is something also called infant potty training. I'm actually working with a woman who heads up a daycare for children with for very, very young children with Down syndrome. And she actually uses more of this infant potty training method where it's really about kind of starting at a really, really young age, even if they're not able to walk on their own, and being able to kind of get them into the routine of sitting on the potty. While this can be, again, very effective, there's not a lot of evidence about what the long-term benefit is in the sense that do kids kind of as they get older regress or not? One of the things that I've been talking to this person about a lot has been that the one benefit is you don't have as much like challenging behaviors around like going and sitting on the potty. So it might be a nice way to kind of start when a child developmentally is at an age where they're maybe a little bit more amenable to doing something that's directed by an adult. So in 2022, we actually published a paper that really queried the families that we saw in the C Center for Down Syndrome where I worked previously to ask them about like the toileting practices of their kids. We had 137 parents or guardians of our kids participate. And what really they kind of indicated when we looked at all of the data was that kids, children and adolescents with Down syndrome started toilet training at about 3.4 years and completed toilet training by about 6.6 years. So that's a good chunk of time, 3 years to become toilet trained. The reason why I like to share this is because I feel like sometimes we put a lot of pressure on ourselves and create kind of unrealistic expectations around the pace of when, how this is going to happen because we think that it's supposed to happen very quickly. And that may be true for our kids with that do not have Down syndrome. And I would say that's even variable. But I would say that our kids just have some challenges that I will share with you that are ones we can overcome, but that may actually make it a little bit more difficult for our kids to develop those skills for becoming fully toilet trained. And so I just want to kind of say realistic expectations are that it may take a little bit longer. That is not true for every single child with Down syndrome. Like I said, I work with a bit of a skewed population because the kids that I see are the ones that have maybe tried all of those other strategies that I just described, but maybe have kind of failed from that standpoint. The other thing that is important is that sometimes our kids have skill loss across the lifespan, and that might be because there are life events. They might start having behavioral challenges. Some kids have medical issues, surgical procedures, things like that might be going on. And that it's actually very typical, normal for our kids to sometimes have some little backsliding related to that. And that can contribute to delays in toilet training as well. The caregivers really found that consistent toileting schedule, using reinforcers, and providing prompting to use the toilet were the most successful methods, which are all ones that I'm going to talk to you guys about today. But that doesn't, again, mean that kids will not get to a point where they're actually going to the bathroom, on their own or even asking to go. But I, again, want to point out that there's a large group of kids who actually are potty trained, but really do still require cueing from an adult. And what we found is that even of the people that shared that their kids were fully toilet trained, when we broke down what are the pieces, what's their definition of being fully potty trained, a large number of them actually said that they were still cueing their kids to go, but that they considered their kids fully potty trained because they were wearing underwear. So again, there's so much variability in this that I really want you guys to be thinking about what's the ideal definition for you. Does that mean that they're going on their own? Does that mean that they are telling you when they need to go? Does that mean that they are going on a schedule? And that might look really different depending on each individual kiddo that we're talking about. So I'm going to talk about readiness skills and the challenges to readiness for kids with Down syndrome. I'm going to talk about anticipating some of those challenges and then planning ahead for them. We're going to talk about steps to get started with toilet training. And in this last one, we're really going to talk about specific strategies. I also did send Whitney, and she's welcome to share this, a step-by-step toilet training guide, which kind of is something that we put together that was just taking these slides and all of the information I gave you, but kind of putting it into like a short little handout that you can follow step by step in order to be able to kind of come up with your own toilet training plan. Like I said, I work with a wide age range. So if there are specific questions that you have, please I'll save time at the end to answer questions, but know that, the strategies we're talking about are probably geared more towards, I would say maybe 4-year olds to adolescents. Like infants can certainly follow the same type of routine, but there might be kind of some little aspects that are a little bit different. Okay, so readiness and challenges. This is actually something from Baby Center. I don't know if anybody's ever gone on the website, but it's really looking at what are the skills that a person needs to have in order to become fully toilet trained. I will tell you that these are things that I think are important skills and probably ones that we didn't think about in to that level of detail as far as like, what a person needs to be able to, what skills they need to be able to have to become toilet trained. But I think that it's a good way to kind of think about what are the little speed bumps or hurdles that our kids might actually have to go through as well. So the first column is really medical and physical aspects. So according to Baby Center and probably like most readiness checklists, a person should be coordinated enough to walk and even run steadily. They should urinate a fair amount at one time. So not like the, newborn little peeing every 2 seconds, but really being able to urinate a fair amount. Having regular, well-formed bowel movements at relatively predictable times. Having quote unquote dry periods of at least 2 hours or during naps, which really shows that they have the bladder control or the muscles to be able to hold their urine for longer durations of time. So when I was mentioning like newborns who kind of are peeing like, every 2 seconds and you feel like you're changing their diaper every 2 seconds, part of that is really related to the fact that those bladder muscles have not developed enough in order to be able to hold the urine for longer durations of time. The second column is behavioral. So can sit down quietly in one position for 2 to 5 minutes, can pull his or her pants up and down, dislikes the feeling of wearing a wet or dirty diaper. And I'll share with you that that's one that's, in my experience, has become kind of one of the more pronounced challenges for our kids. Showing interest in others' bathroom habits, giving a physical or verbal sign when they have to go to the bathroom, like grunting, squatting, telling you. I would actually argue hiding is another big one. Hiding behind the couch when they need to poop, or a specific place in the home. Demonstrating a desire for independence, taking pride in their accomplishments, not being resistant to learning to use the toilet, and in a generally cooperative stage, not a negative or contrary one. I always think that that last one is so funny because I think it's a very small window where our kids, any kid, is super duper cooperative and wanting to do people pleasing before they realize that they can say no and they can have agency over themselves. So that one kind of tends to be one that I think is even a little bit more challenging for our kiddos with Down syndrome. And then the last column is cognitive. So they have to understand the physical signals that mean that they have to go. And they have to tell you that they have to go before it happens, or they can hold it until they get to the bathroom. They can follow simple instructions such as go get the toy. So like what we call single step directions, understand the value of putting things where they belong, and they have to have the words for urine and stool. Now, I don't know about you guys, but when you think about toilet training, I personally don't always think, I mean, I do now, but I didn't previously think that it had this many different components to becoming toilet trained, because we think of toilet training as kind of like one thing versus like these separate skills that a person must acquire. So I think it's really important to be able to look at it from that perspective. Now, I want to talk about the same columns, those three columns, but I want to talk about why these things are actually more challenging for our kids with Down syndrome. So first, let's look at medical and physical. In the medical column, we know that our kids have delays in motor control, so development of their gross motor skills, so being able to walk, being able to run, things like that. Our kids have low tone, which can make it really difficult to kind of sense and know when your bladder is full, or when you need to go poop. So that having that low tone just gives you less awareness of what's happening inside of your body to then be able to signal that there's something that behaviorally you need to do, like walking to the bathroom and then sitting on the toilet. our kids actually have really high instances of constipation. So anorectal malformations, not uncommon. Things like Hirschsprung's disease, not uncommon. And, I would argue that, this ties into the next bullet on chronic GI issues because our kids can have really variable diets. I work with a lot of kids who have feeding difficulties, who have histories of aspiration, who may be G-tube fed or may be on a limited diet or have to use thickener. And so when we think about those things, those can really impact how we pee and poop too. If we only eat certain foods that cause more constipation, that can also really impact this overall idea around toileting. One of the things that I talk about a lot is really how much being constipated impacts even your bladder control, but I'm going to share that a little bit more in detail here in the next few slides. Our kids have a difference in stature, so their size is a little different. So they might have challenges with reaching the toilet seat or even wiping because of shorter arms or not being able to reach. And that's an important aspect too. Fine motor challenges are very common in our kids with Down syndrome. So we may think of it from the standpoint of just like writing, maybe a big challenge, but think about things like buttoning and unbuttoning or zippers or things that, are involved in clothing that may make it more difficult to actually be able to be independent in the bathroom. In the next column, we think about the behaviors. So think about on the previous slide, we talked about what are the readiness skills you have to have. And then this slide is really highlighting what are the things for our kids that might make it a little bit more difficult. Our kids have delays in impulse control and attention span. I have this talk that I do on behaviors that really talks about the neurodevelopmental profile of kids with Down syndrome and really about brain development. And so that impulse control is something that is controlled by the front part of your brain. And we know that there are delays for kids with Down syndrome related to that. So if I have a shorter attention span, I might not be able to sit on the toilet for the duration of time I need to. If I have impulse control, I might be like getting up off the toilet before I'm done. So that can be a challenge too. And I want to reiterate, as I did at the beginning, that we do not believe that all children with Down syndrome are exactly the same. Some kids will have some of these things as challenges, some kids won't. The reason I highlight these is because these are the things that most frequently, can be, like I said, the speed bumps or the hurdles for toilet training. Sometimes our kids are super duper motivated, but maybe by their own interests and maybe not really concerned about having a wet or soiled diaper. I actually had an appointment with a family I'm working with on toilet training this morning. And one of the things that, she shared that the mom shared with me is that, her 7-year-old who we're trying out in underwear right now is like asking for a pull-up because he knows that that's, kind of easier to be able to kind of continue doing what he wants to do in that moment. And that having underwear on is a little bit more anxiety provoking. So we were kind of troubleshooting, how do we help him to feel a little more confident within that standpoint. Demonstrating a desire for independence, but related to their own interests. So our kids do like to learn and be independent, but sometimes it's not necessarily related to toileting. I like the word willfulness. You may have heard the word stubborn as kind of the associated characteristic for our kids with Down syndrome. I don't like the word stubborn because that implies that it's just a personality characteristic. Whereas I think willfulness really says like, I have a lot of motivation, but maybe those motivations are really directed towards the things that are getting my needs met in this moment. And that's why I like using the word willful. But that can be a part of the behavioral challenge for toilet training. Breaking an old routine. So this is where I was saying, like, we can't wait for all the readiness skills to arrive for our kids because we may actually that we may actually experience this feeling of I've been wearing my pull-up or my diaper for such a long time that why do I need to do anything different? And so it becomes a more challenging the older our kids get with breaking that old routine. And we know that our kids can get into a groove and really stick to it. Sometimes our families just really aren't ready to do toilet training because it is a very intense and time, time eater, for lack of a better phrase. It takes up a lot of time to have to be able to do the various steps that we're going to talk about for toilet training. And frankly, it's not like our families are saying like, no, we don't want to toilet train our child. Sometimes there's just things like battles with school districts around inclusion, health conditions, surgeries, all these other things that might actually interfere with the ability to really focus on toilet training at that moment. Um, Anxiety, our kids can feel anxious, and so that anxiety can definitely be a behavioral aspect that becomes a challenge. Even though sensory issues are typically associated to kids with autism, I actually think that it happens quite frequently in kids with Down syndrome. If you have sensory issues, you might actually be oversensitive to loud noises like automatic flushing toilets, or you might be sensitive to sitting on a toilet seat that, is, you know, uh, ceramic and cold versus, a plastic one. So our kids can actually have things that impact from that standpoint too. And then finally, the cognitive elements. We know that our kids have communication challenges, and so letting someone know that they need to go might be a little bit more complex. Some of our kids will sign. Some of our kids will use augmentative communication. Some kids will use their voice. But again, there's just lots of different ways that our kids end up communicating. And so if we're just waiting for them to verbalize it and not looking for those other ways in which they're communicating, we're going to, not have the information necessary in order to help support that toileting process. Many of our kids are very in the moment. And so they may lack understanding about why toileting in the potty is important on a grander scale, right? Like, how many of our kids really think about like, well, it'll be easier to go on, to sleepovers, or people might not like being around me if I have a poopy diaper. Our kids aren't necessarily thinking about those things at this young age. And so it may make it even less motivating in the grand scheme of things to become toilet trained, especially when it's a child who's a little older and might have been wearing diapers or pull-ups for a long time. And then finally, our kids do have some difficulty with generalizing skills across settings. And so we do want to make sure that we're also working really hard to have them practicing in different settings. And so we'll talk about that too. So despite the fact that I'm sharing with you some of these like hurdles, or speed bumps, I want to let you know that there are wonderful proactive strategies that we can use in order to help support moving forward with toilet training. So first and foremost, I always encourage families to think about those medical pieces and the physical pieces related to toilet training. So if you have a child who experiences constipation, be sure to address that ahead of time. And the reason why that's particularly important is because our bladder sits on top of our intestine. And so if we are impacted, meaning we haven't pooped in one day, we can have stool that, hardens or is stuck in the intestine. And so that may constantly be giving the bladder signals to urinate, which might mean we keep peeing like every, 10 minutes, every 15 minutes, every 20 minutes. Or it can make you kind of become desensitized to the signal where you're not even paying attention to it anymore. And so if we are constipated, we want to make sure that we address that so that we have the highest chance of then having a full bladder and giving our body the opportunity to understand the signal that it's getting in that moment. So I really encourage you to talk to your primary care doctor, your child's primary care doctor, if you're the pediatrician, if there's any concerns about constipation. What they will do if they think that that's of concern, oftentimes is they will recommend an x-ray of the abdomen. It's called the flat plate of the abdomen. And if they do see a lot of stool, then what they will suggest is doing a clean out if it's necessary. And so, and then you can proactively really try to remain constipation free by, paying attention to diet. Some families, use Marilax. I know that can be really controversial. Some people use Senna, but there are also, more natural ways to kind of keep the bowels moving as well. So once you've been able to kind of get someone to be constipation free, then, you want to kind of stay on top of that as much as possible. So other things to plan for medical and physical aspects. So to address the physical challenge, we want to make sure that our kids' legs are comfortably resting on a stool with the knees slightly above the hips. I don't know if anybody's heard of the squatty potty, but the whole idea behind that is that it actually angles your intestines to be able to have the highest likelihood of then being able to, get rid of poop. But it really is actually very true for our kids too. And so if they have, shorter stature, they may need a stool or something to kind of prop up their legs in order to be able to sit comfortably. This is also going to allow them to have their body relax enough to be able to have a bowel movement or to even urinate without kind of like holding themselves up and tightening all of their muscles. Clothing should be easy to pull off and on. Sometimes that means like leggings or, a t-shirt, especially if you're working on this at home. I would actually say it's even okay to, have no clothes and just a pull-up, while we're working on this in the beginning, just to kind of avoid that becoming the added challenge. Whichever type of seat you use should provide confidence and stability. So that's what I was saying earlier about like, there's lots of different, types of seating. And I really do, I don't have like one specific recommendation. It's really individual specific, what's going to make them feel confident and stable in their seating position. Flushable wipes can be, more helpful than toilet paper for our kids. But for some kids who have sensory issues, that might actually be a challenge as well. So these are all just things that, kind of are like accommodations. You may have heard that word even in a school setting, but accommodations to help support making these things easier. Here are just some examples of different types of seating. For really young kids, I do like the potty chair on the floor down here, this pink one on the floor. But for a lot of our kids, when they're toilet training and they've become older, the problem is that those seats usually don't fit their size, number one. And number two, I don't think it's a total bad idea for kids who have some impulse control challenges to actually be able to, to put them in a seat like this first one right here that's red, blue, and yellow, where it might take them a little longer to get off the toilet, which kind of increases our chance that they might produce something in the toilet. So I'm not opposed to that either. I think it's really, again, that we don't want to force kids to be sitting on the potty. We'll find motivating ways to help them sit, but that we want them to be comfortable and stable. When we talk about planning for behavior, we want to address impulse control. So that's that second column we were talking about for readiness skills. So to address impulse control and attention span, I love visual timers. I use them in every single aspect. And so many of you may have already introduced this in other parts of your life, but I really encourage you to think about using it in the context of toilet training. We can do anything if we know how long we have to do it, right? And so if we don't have that clear-cut ability to see how long do I have to do this, a lot of times our kids will keep getting up, keep getting up, keep getting up, getting up. But I love this one with the duck the most, because what it is that it's a smart app that's called Children's Countdown Timer, and it's free. It does have some pop-up ads, but it's free. And what you do is you set the amount of time that the child needs to sit on the toilet or however you're using it. And then when you press start, a picture is revealed when the time is up. So it'll, reveal the duck, and then it'll make a, squat, it'll quack and it'll spin, and it like has kind of like a little animated, sparkles that show up. And so our kids know that time is up, when that picture is revealed. Because the concept of time is so hard for our kids to understand, this visual provides an ability to not just help our kids understand how long that they have to sit, but it actually gives us the ability to increase how long we're asking them to sit by simply changing the amount of time that's on there. So our kids are really focused on when the picture is revealed, that's when I can get up. But maybe when we first start, we're having them sit for 30 seconds. So the picture is revealed in 30 seconds, but then maybe we work our way up to 1 minute. and they're sitting for a minute, which, is longer and more gives us a higher chance of being able to pee or poop in the toilet. But they still see the same thing, which is where when the picture is revealed, that's when time is up. So we can actually work on kind of stretching the rubber band of attention span and reducing impulse control by using those types of timers. Placing toilet paper and other distractors out of reach or removing them completely when you're first starting. Again, I haven't noticed this being like a huge challenge for all of our kids. I've actually seen that kids really love throwing toilet paper in the toilet and then flushing. So sometimes what we do is we cover up the flusher until after they've produced something or after they've sat for the amount of time, and then they can flush the toilet as kind of the reward. You'll notice that I'm not a big proponent of food rewards for a number of reasons. One of the biggest being that our kids have more difficulty with obesity and have slower, rates of metabolizing, which then can result in increased weight as well. So I try not to use food rewards as ever. I try to use social interactions, praise, being able to engage in a preferred activity, things like that, as the motivator. But sometimes we do end up having to resort to that. So you just heard me say like flushing the toilet can be the reward. And it may sound like, oh my gosh, that's ridiculous. But I will tell you that it's actually worked quite often with our kids. So we might sometimes have to utilize a motivating toy or book to get the child to, go and sit on the potty. But you'll see later on that I am not a big proponent of having something preferred while you're sitting on the toilet. I've had kids who will have an iPad and sit on the toilet, and they could probably sit there for like hours and produce nothing, and just be happy because they have the iPad. So I try to really keep their reward to after they've completed whatever they need to do in the bathroom. But just for some kids who have extreme impulse control issues, we sometimes do have to use that as a starting point. To address motivation, you may have heard people use this thing called first then directives. First then directives are the shortest direction you can give to a child that tells them what they have to do that might not be super motivating, and then what they get to do that's preferred right afterwards. So we are always, some people use if then as the same kind of concept. I don't like if then, just personal preference, because I feel like that you're already setting somebody up for a consequence. Like if you don't do this, then you can't have this. Whereas first then it kind of feels more like you just do it in this order, right? So first we go to the potty, and then we get to play with blocks. First we wash our hands, then we can play with the truck, whatever it is, right? For some of our kids, it might be first let's go potty and then we have lunch. If meal times are super motivating. So it's just adding it into the schedule, but highlighting that the reward, quote unquote, is not just like I'm giving you something that I wouldn't ever give you, any other time. It's really just saying in this sequence, we have to first go potty and then we can sit down to eat our meal that still might be preferred. If a child is already playing, placing your hand on the toy and saying first potty, then come back to play. I know that sounds like ridiculous. Like, why would we have to say that you can come back to play? But for a lot of our kids, what ends up happening is they get this idea in their head that if they're going to have to leave something that they're doing that they love, that they're not going to be able to come back to it. And so using that first then directive to actually tell them like, no, you can come back to this as soon as we're done with the potty, can be, a really good way to motivate that transition. And then you do sometimes have to put your hand on the toy to prevent them from just continuing to play or engaging in whatever they're doing, because, well, why would I do something that you want me to do when I already have the thing I want? So that's an important piece to pay attention to as well. In this bottom right-hand corner, you'll see something we call a visual roadmap. A visual roadmap is a description of what the consequences will be based on what choice that you make. So this was one that we created for a patient of mine who was doing amazingly well with keeping her pull-up dry during the day, but really was having more challenges at night. She was able to hold it, but what would happen would be that she would wake up in the morning and she would wait for a parent to come into the room in order to, kind of start the morning routine. Now, the challenge in this was that she would pee before they had a chance to take her to the bathroom, at the start of the day. And so, but she was very capable of being aware that she needed to go. So in this instance, one of her favorite things in the world was her dad walking her to the bus, which again is not a food reward. It's not a toy. It's not something, like special in that way of like a tangible item, but it was something that was super duper motivating. So we created this visual to say, if you have a dry pull up then it goes to the left, then dad will walk you to the bus. If you have a wet pull up, then dad won't walk you to the bus. And we made a laminated copy of this and stuck it to her bedpost so that right when she woke up, she saw this visual and it became the motivator for her to go, oh, I can actually get up and go to the bathroom myself. She already had the skills to be able to do that. This was just breaking an old routine and helping her to learn a new one. And she did great with it and ended up being able to stay dry, not just during the day, but then overnight as well. More behaviors. So how do we address getting rid of an old routine? We use visual schedules for a lot of different reasons. And I actually think that sometimes people get kind of a little bit rigid in saying, oh, well, our kids are visual learners and that's why we use a visual schedule. But visual schedules are amazing for so many different reasons. One, a visual schedule tells you what to do. Two, a visual schedule tells you how much you have to do and what's going to come next that's maybe more motivating. Number three, a visual schedule, if it's like a Velcro schedule or one that you mark off, can show that you're making progress towards the thing that you want to do, which then adds embedded motivation. And number four, it really allows us to help kids to slowly transition into a new routine. Schedules are oftentimes quite familiar for our younger kids. So if we use a visual schedule to help them know what they need to do if they have an accident, like this mini schedule that we have on the right that we actually leave in the bathroom. For this was an older child who could actually help with some of the more independently if if he had an accident to be able to change and to get his body clean. But for some kids, it's just having a visual schedule that shows a toilet that now is part of the new routine in the morning. So we wake up, before we would wake up, we'd brush our teeth, we'd get dressed, we'd have breakfast. Now we wake up, go potty, brush our teeth, get dressed, have breakfast. So it's just kind of an easier way to transition into a change in a routine. We like to keep times for toileting the same for a lot of our kids because, again, our kids really do well with routine. And the more routine that they have, the less anxiety they have, the better that they're able to actually meet expectations of the caregivers around them. Some people ask me about a potty watch. You'll see an example in the left corner. And they say, can we teach them to use a potty watch? In my experience, kids just ignore when the potty watch goes off and turn it off if they're engaged in a preferred activity. So in that instance, it's not super duper helpful. For caregivers who might be like, I want to take my child every hour and a half to the bathroom, you can actually wear it yourself to kind of help you remind yourself so that you don't have to like set a timer every 90 minutes. So in that instance, and it can be a way to familiarize a child with the sound of it to know that it's time to go potty. But like I said, I don't tend to use it as a first line of defense because kids will just ignore it and it'll just be beeping and it's not necessarily as helpful. So breaking an old routine with gradual change. We start off with like one time going to the potty right when we wake up. When that stops being kind of a challenge, then we add another time right before we leave for school or right before we go to bed or right before we get into the bathtub. But we again keep that time the same. This isn't one for our younger kids. We may not be thinking about this, but more oftentimes than not, our kids are really, really thrive off of social engagement and social interaction. And so we don't think about like the behaviors that we have when we're changing a child who has a wet or dirty diaper. But a lot of times it's one-on-one attention and we get really animated. We make silly sounds. We sing songs, things like that. And so our kids kind of are like, this is cool. This is good. I like this one-on-one time. So it doesn't mean you have to be mean when you're changing the child, but we don't want to give lots of positive attention until after the changing process or the cleanup routine is done. So we might just say, oh, time to, change our diaper, we always want to change in the bathroom to, again, help create that consistency of this is where pee and poop go as much as possible. And not like in the living room or another place of convenience, because we, again, want kids to understand that peeing and pooping only happen in the bathroom. But when we are changing them, we want to minimize attention, just get the job done. And then right afterwards, we can give them lots of attention and praise and engagement in whatever way we want to. As developmentally appropriate, we want the child to help in the cleanup process, but again, developmentally appropriate. To address parental readiness, I always encourage caregivers to ask yourself, why am I doing this now? There are some families that have come to me and said, I desperately need to toilet train my child. I have 2 months to do it. And it's really related to a school setting saying you can't be in an inclusive classroom if you aren't toilet trained. And what I say to that is that's not a good enough reason, and we're not going to put that type of pressure on the child. Those are the times where I really try to be an advocate for the families with whom I work, to being able to say, like, that's against a child's rights to have that as a limitation in being included in that environment. If you're doing it for that reason, like you're like, I just want to be done with it and I want to, have my child toilet trained, that's fine. But just know that it's not necessarily going to be a quick 2-month time frame. And if a caregiver is anxious, then your child is going to be anxious and it's not going to go as well. Do I have the time to give this my full attention? Again, kids are engaged in surgical procedures. There's all kinds of things that could be happening, in our kids' lives. And I'm not saying, okay, well, if you can't give it your full attention, then don't do anything at all. It just means make a smaller goal. You just saw me describe 3 different columns worth of skills that a child has to have. So if you can't give it your full attention, pick one of those pieces that you're like, I just want to get them into the routine of sitting on the potty. I'm not worried about whether they produce anything or not. I just want to get them into that routine. Great. That's your goal. You're giving your full attention to taking them consistently at a specific time, but without the expectation of something actually being produced. Generally, how do I approach teaching new skills to my child? Do I get nervous even before starting? There's so many things we're teaching our kids, and yeah, sometimes we can get nervous about them. So just knowing kind of your own personality and then being able to say, who's in my village that can help me, that, can help give my child this message also that this is not scary and we can totally do this. So being able to build that. How will I handle obstacles along the way? So really asking yourself, what are the things that I anticipate my child might have a hard time with on those challenges for kids with Down syndrome around readiness skills, and then being able to be prepared to address that. To address anxiety, we want to keep things predictable using a routine. We want to use the same language across settings. I had a child who was doing really great with toilet training at home. At school, he was having accidents. And what we discovered, I said, to the mom, I was like, can you go into the school and maybe just observe kind of how they're doing the toileting process, right? Because they were still cueing him. And what she discovered was that at home, her kiddo would sit on the toilet, pee a little bit, and then say, I'm done, and get up really quickly. And so he wasn't emptying his bladder fully. At home, mom knew that there was no way that was the only amount of urine that he had. And so she would say, make more pee to get him to urinate more and fully empty his bladder. At school, they didn't know that. And so if he peed a little bit, they were like, good job, and they moved on. And that's why he was having accidents. So using that same language across settings, he was able to, again, develop the skill to kind of get to that next level of being able to stay dry, even if it was on a schedule. We don't want to push kids to do a step they're not ready for. I have had some kids who really are terrified of pooping in the toilet, and we're not going to just sit them on the toilet and say, like, we're going to stay here until, you poop. We want to take a more gradual approach. I do another talk on desensitization, but within the context of toileting, what I would say is it might mean sitting on the toilet and pooping in your pull-up, right? And getting comfortable with that, which I know is a little bit strange, but getting comfortable with that before we actually do anything else that is closer to what the end goal is, which is actually pooping in the toilet. Giving choices can be a great way to reduce anxiety. Control is the underlying reason why anxiety is present. It's because you don't feel a sense of control. So when we say giving choices, it doesn't mean do you want to go to the bathroom or do you want to not go to the bathroom? It's an adult directed choice. So it's how do you want to get to the bathroom? Do you want to bear crawl to the bathroom or do you want to hop like a bunny to the bathroom? The idea is that the end result is still what you're looking for as the caregiver, but that you're embedding some choice to reduce anxiety and to help our kids to feel some agency over their life. I know that it may sound like a very small little thing, but we see giving choices across the board all day, every day, as being such a beautiful way to keep kids engaged and to help them feel like they have some agency over their life. And then I always say slow and steady wins the race, and you'll hear me say it again later too, because I think that sometimes we get really hung up on, we got to do this really quick. And frankly, our kids, learn at different paces. And so we have to meet them where they are. To address sensory issues around toileting, we want to keep the bathroom quiet. Automatic toilets can be really scary. And actually, I would argue that it's scary for every child at a certain point in time. But for our kids, sometimes it can, result in kind of an even bigger reaction. And so I can't believe I found a picture of this, but if you look at the bottom right corner of this slide, you'll see that the person is just putting a little sticky note over the sensor. So you just keep a little pack of sticky notes in your pocket. And when you're in a public place that has automatic flushing toilets that might be particularly scary for your child, walk into the stall and cover the sensor so that when they go in, it doesn't start flushing just because of body movements. And then once they're done and out of the stall, then you can remove the sticky note so that it flushes. So sticky notes are a great little trick to be able to use. For home toilets, you might have to get a different toilet seat depending on, fit and ability to sit on there and if they have some sensory issues. Wipes can be a good or a bad thing. Earlier, I said wipes can be a really good thing for cleanliness for our kids who have a harder time with reaching. For some kids who have sensory issues, however, it might not be helpful. So I'm trying to help you guys generate ideas that you can consider for your own child. And then if it's something that fits, great, use it. If it's something that doesn't fit, then we don't use it. So we kind of have to be flexible from that standpoint. Some of our kids with sensory issues really have a strong reaction to air fresheners or potpourri. So anything with strong smells. So just being really aware of that. And then planning for cognition. So to address communication, we use visual schedules. I say photos is best because we want to make sure that whatever visual schedule we're using is developmentally appropriate. You guys may have seen visual schedules used in like school settings or in therapies where it's kind of like these cartoon drawings of activities that are put onto a piece of paper. For some of our kids, those are fine to use, but you really should work and discuss with your speech therapist if you're working with someone, or even, just a psychologist or somebody that, understands communication and development related to communication really well, to be able to say, what does my child understand? Really, really young children and children who are higher needs may only understand objects, which means like I hand you a diaper, so it means it's time to change your diaper. I hand you a toothbrush, that means it's time to brush our teeth. The next level is photos, right? So photos of actual objects or actual things or actual activities. So that's the next level of concreteness. Then we do those cartoon drawings and representations. So some kids, a visual schedule is not useful if the child does not understand what the pictures actually mean. So you might have to play around with what that looks like for your child, but I do think that it's a great way to help with communication. When you say it's time to go potty, like Miss Rachel, you want to sign potty to help create an association. Again, it doesn't have to be for every child that they sign potty. If they have the words for potty, that's fine too. But we want to be flexible in meeting the child where they are for their communication skills. I really encourage families to start using first then directives in general. You can say first put on shoes, then go outside, first sit on the potty, then have lunch. If it's like doing academic related work, it's first, trace 3 letters and then go play with a toy, whatever it is, but start using those first then directives, generally speaking. To understand comprehension, You may or may not have heard of something called a social story. So a social story is just a story that is in the first person that tells the child what behaviors that they need to have in a given context. I also like to include things like troubleshooting. So like if I'm feeling nervous, I can take deep breaths. Or if I, don't know if I can't pull down my pants, I ask for help. Like, so it might be some nuanced pieces like this. This was a story or a social story we wrote for a kiddo who had a CPAP machine and was not going to the bathroom because kind of like had this moment of like, I don't know what to do with my mask when it was time to get up and to go to the bathroom. So we actually wrote this social story to kind of help the child, and we read it ahead of time. So read it right before bedtime every single day to help this child to understand like that they could actually take it off, go to the bathroom, come back, put it back on. So the social story is going to be individualized to the person who needs it. To address generalization, we use similar tools in all settings. So the same type of visual schedule, the same type of cues, the same type of language. We really want to help others understand the importance of keeping a routine. I mentioned this before, but using the same language across settings is going to be really important as well. So those are all proactive strategies that you can use in order to plan for toilet training. Like I said, you will not have to use every single one of those strategies because every single one of those strategies is not going to be pertinent to your child or your loved one with Down syndrome. So what we want to do is we want to say, okay, I have all of those things that, in mind. I have a kiddo who really thrives off of a visual schedule. I have a child who really likes choices. I think a timer is really going to work well. And so what we're going to do is we're going to build our toolbox. We're going to make or, create our visual schedule. We're going to get the right seating for our child. We're going to pick what timer we might want to use. We might say, oh, my child actually, I think would do really well with wipes. They don't have any sensory issues. So we're going to put that in our toolbox too. So the idea again is your toolbox is for your loved one with Down syndrome. It's not going to be something that everybody might have. Step 2, I really encourage that if you don't know how often your child is wet because we're not checking constantly, is that we check. I usually like to encourage families to look at a 3-day time frame where at 15-minute intervals, you're going to check to see if your loved one is wet, dry, or soiled. If they are wet or soiled, you're going to change them like you normally would, but you're going to also track on your sheet that they were wet. If they're dry, you're going to put a D for dry. This tracking sheet starts at 5 a.m. That does not mean wake your child up and start checking at 5 a.m. It really means whenever time that they wake up, that's when you're going to start tracking. So you're going to track from the time that they wake up to the time that they're asleep for 3 days. And what that's going to help you to do is to see the pattern. You're going to say, oh, it looks like we have 3 or 4 D's in a row. That must mean that they can hold it for 45 minutes approximately to an hour. And that's going to help us then determine how often we're going to take our child. So it's not an exact science. You could definitely do an exact science version where you're tracking, even more intensely than this. But I have found that most families, this feels like a manageable amount of days and a manageable amount of data to collect. So then once you know that, you're going to create a schedule for when to take the child to the bathroom based on that data that's collected. The time intervals should be just short of what you determined on your tracking sheet. So if you're like, oh, every hour they seem like they have a period of time where they're wet, then maybe I'm going to take them every 45 minutes. The idea is that you're going to try and catch them when their bladder is full so that they maybe even accidentally just empty into the toilet. So they're starting to make that brain body connection of like, oh, this is where pee goes. And that addresses that third column of comprehension. Natural transitions can be a really great time to take kids when you're starting out also, because there's less of a challenge with the actual transition. Families tell me all the time, I can't even tell you how many times, the number one behavior that they have difficulty, that their child has difficulty with, is transitions. And so if they're doing something preferred and you're asking them to transition in the middle of it, you may see a lot of resistance when you're starting this out early on. Whereas if you're doing it right after they wake up, before they start their morning routine, it might be an easier point of, transitioning from one activity to the next. And so you want to really lay out like when is that going to happen each day. And like I said, a visual schedule is a great way to help the child to know when it's going to happen as well. I always encourage families to pick a period of time that will allow their loved one to be successful and for the parents to feel successful. If you're on vacation, or if there's a major surgical procedure or something happening, I really discourage, doing kind of an intensive toilet training process, because that's just not predictable, right? Like you don't know when you're going to be going to have access to a bathroom. We don't know, like making pit stops can be really challenging when we're doing it at high frequency. And frankly, when you're on vacation, you want to be on vacation. So it doesn't mean you're never going to be able to go on vacation again. I say just when you're starting, let's create a very consistent routine and really have success in this home setting before we then kind of take it into a vacation or a less predictable situation. I always say that it's important to identify your child's strengths, your family's strengths, and who in your system of support also can help you with this. The more that everybody is working together, the faster and the easier this is going to be. This includes other caregivers too. So grandparents, respite care providers, whoever we're thinking about, but having everybody be able to do that. And then the last step is now you have your game plan and you're going to try it out. You're going to say, okay, my goal is to take my child to the bathroom 3 times every day. Here are the times I'm going to take them. I'm going to get really consistent with that. I'm not going to worry about whether or not, they actually produce something in the toilet or not, but this is where I'm going to start. And then what we do is then we can kind of work towards something that's a little more intensified once that goal has been achieved. So even in my notes for provider or for families that I work with, I actually have a drop down list that highlights what the current goal is, because I don't want to, say like toilet training is the goal, right? Like what we're going to do is how can we get 75% to 100% accurate with consistently sitting on the toilet, at these times. Once that goal is achieved, then we reset and say, what's the next goal? And so I would encourage you to do the same thing and not think of toilet training as like one huge whole ordeal, but really being able to think of it as pieces. Couple of little quick tips that I just want to highlight based on questions that families have asked me. So really have your child sit for 2 to 4 minutes. If you're having them sit for longer than that, the chance of them actually producing something, not necessarily for pooping, but for peeing, is probably not very likely unless they're actively like holding it in. And so I usually don't think that kids have to sit for that much longer. If your child can't tolerate sitting that long, start out with smaller increments of time and build up. The reward should be given after toilet training so that it's not a distraction. So kids don't think like, oh, we just sit on the potty and hang out with our iPads. I know adults do that too. So not being critical of it. I'm just saying that during the toilet training process, we want kids to understand that we're doing one specific action and then we're moving on. If your child has an accident, minimize eye contact, talking, facial expressions during cleanup. And please, please, please don't punish or say, pee goes in the potty, because most of these things I hope from this presentation you're learning are not totally in our kids' control. There are so many little speed bumps and hurdles that our kids are trying to overcome. And so we have to, for the long run, kind of be our kids' cheerleaders. If there is a behavior involved, then we address the behavior, but we don't make our kids feel bad about having these accidents kind of on a holistic level. Have your child participate in cleanup when developmentally appropriate. And like I said before, slow and steady wins the race. Common questions. Should I only worry about toilet training when all the readiness skills are in place and the challenges have resolved? My hope is that everybody on the call will answer no. There are other skills that I can be working on that will ultimately lead towards being fully toilet trained. Should I put my child in underwear? I am not discouraging you from putting your child in underwear. What I will tell you is that putting your child in underwear before you've established a good routine where they've been able to stay dry more oftentimes than wet, I really discourage people putting kids in underwear right away. Again, I'm not saying that that hasn't worked for some kids. The kids I work with tend to be the ones who are having a bigger challenge, and families can't sustain the number of accidents our kids will have before it clicks to be able to use underwear as that motivator. How long is this going to take? It's quite variable. I would say expect at least a year as a minimum. It usually takes longer. And there's no shame in being fully potty trained on a schedule versus being able to recognize and ask to go themselves. What do I do if my child is chronically constipated? Talk to your pediatrician, to your primary care doctor, and see if they need to do a clean out. Should the reward be during or after toileting? I am in favor of after, unless you have a child who is really, really impulsive and has a hard time sitting for any period of time. What if my child refuses? Put your hand on the activity or toy that they're playing with and remind them, first we're going to go potty and then we can come back. You can also use adult-directed choices, other ways of motivating, or maybe you just reframe and you go, maybe I need to start off with doing natural transitions as the point at which I take my child so that the refusal is less. How do I create consistency across settings? We have to have the same language. We have to use the same visuals. We have to, that plan that Whitney will send out to all of you. I would say, fill it out and then share a copy with anybody that's engaging with your child that can help support the toileting process. I did have the privilege of writing this book with a co-author, and that's kind of where the title of this presentation came from as well. I'm going to give you my email address. If you're interested in purchasing one of the books, I still have some of them. The publishing company that published the book went out of business, and I bought all of the last copies because they were just going to incinerate them. And then once these copies are sold, then I will be publishing on Amazon so that families can have access to it. But it's kind of a more detailed version of the presentation that I just went through right now. I do provide telehealth services, but it has to be in the state of Colorado, which I know makes no sense for things like toilet training where there isn't a risk. But as a mental health provider, I have to only practice in the state where I am. I will tell you, though, that I have a soft spot for any family who has questions for their child with Down syndrome who's toilet training. So you're welcome to email me and I can throw out some ideas, even if I'm not providing direct care to your loved one. Or if you happen to be in Colorado, you can also call and schedule an appointment with me. All right, I'm going to stop sharing so that I can see your lovely faces. I see that there's things in the chat. I'm assuming that maybe there are some questions. But I just want to open it up and see, who might have questions. Let me just actually see what's in the chat. Recording will be shared. Any idea alternative approaches to address constipation? Addressed with pediatric and GI for years. I'm not sure what was done from a GI perspective. Like, was it proactive, changes in the diet? Was it prune juice? I'm not sure what was included. But I would say that those are kind of the biggest ones, the proactive strategies. Unfortunately, if your child has a variable diet, that can actually make a huge difference. So if you can include a lot of fibrous foods, that's a great alternative. And then there are, like I said, natural things like senna, which families are a little bit more comfortable with giving their loved one that can kind of help with constipation. I encourage use of a probiotic as well as a way for helping to proactively manage constipation. But I'm assuming that the ideas that the pediatrician and GI gave would probably, be along those same lines. Copy of the presentation, yes. Have you seen success if you cannot get consistency across the board with daycare and school? So Sarah, I will say it's hard for a number of reasons if there's not consistency across the board. If our kids aren't understanding that the this is a skill that is an expectation in all places. Unfortunately, what ends up happening is that our kids think that are going to be harder on the person that's trying to toilet train them and take them on a schedule. So there might be more resistance in that setting and not in the other setting where they're not doing those things. So I would actually say yes, that consistency is really key across settings. And I would say yes, a pediatrician can write a letter of medical necessity for frequent potty breaks. For school, it can be a part of the IEP as well. It could be part of the medical plan. And really, the phrase that I would encourage you to use is that by not taking my child on potty breaks or trying to facilitate toilet training, that it's reducing their access to equal education. And to me, like, I don't like to come with, guns a-blazing in these situations, but I do find that a lot of times we do have to take that approach in order to get, everyone on board. Any advice on children with dual diagnosis of Down syndrome and autism? I would actually say that all of these strategies, oh my goodness, hi cutie. Sorry, I got a little distracted by a very cute face on the screen. So what I would say is that yeah, the strategies that are in the book are very much, and the strategies we've talked about are ones that we absolutely think work for kids who are dually diagnosed as well. We might have to take the approach a little more slowly. And I would say that maybe the communication challenges that some of our kids who are dually diagnosed have may make it a little bit more difficult, but that absolutely you can still toilet train using these same strategies. And if you want to email me for specific questions, I'm happy to answer a little more clearly as well. My child will initiate and take himself to the bathroom to potty at school, but does not do this at home. I don't know what to do. We always have to take him. Also, I'm not 100% sure, but I'm afraid I have maybe accidentally made my son start trying to not go poop. I have told him we don't poop in our pants, we poop in the toilet, and I have verbalized disappointment or frustration when he has pooped in his pants just minutes after sitting on the toilet for a long time. Okay, how do I undo the mistake? You feel terrible. I don't want you to feel terrible. I don't want you to say it's okay to go poop in your pull-up. I would encourage you to not say anything or just giving the reminder of, remember, poop goes in the potty, right? So it's not like there's a difference between just a reminder of poop goes in the potty versus going, oh, I'm disappointed in you. I can't believe you went in your pull-up. And again, maybe it's different for different stages too. If it's a child who is pooping in the toilet really regularly and then this is a one-off, I mean, I would say that that's a little different than when we're first doing the toilet training process. So the way to undo it is when he poops in his pull-up, I would encourage you to just say, oh, let's get cleaned up, go to the bathroom, even dump the poop in the potty to show, remember, poop goes in the potty, and then move on, right? And wait for the next opportunity. So I would encourage you to think about it from that standpoint. With regard to your child initiating and taking himself, do you know for a fact that he's actually peeing in the toilet when he's self-initiating at school? If he is, then great. What we would need to do is help translate and generalize to home. I don't know how willing the school staff would be, but I would actually see if maybe the school staff could either make a video that you can show your child at home that's about like being able to, you can go potty whenever, you can stop and go whenever you need to. Or if the school is willing, could one of the school staff come home and like hang out for an hour or babysit for an hour, where we can again help the child to understand that the expectation's the same in each setting. I know again that sounds like very tedious, but sometimes our kids get really hung up. I see this with wearing glasses and things and medical equipment too, where they'll do amazing and wear it all day. And the second they get in the car, they take it off. And it's kind of this rule in their heads where it's like, I only do this at school. I don't do it at home. So we have to think creatively about how do we like create this integrated plan. It can also be that the school can start using like a hall pass, like a visual, of when your child needs to go to the bathroom, they hand it to the adult or they put it on their desk. And then we have the same visual at home so that, again, it's just a visual cue of, look, you can go by yourself. I would also encourage you to minimize how much talking you're doing when you are taking your child to the bathroom. Again, to just make sure that we're not accidentally reinforcing that one-on-one time. So those would be some of the suggestions that I would make. My son was peeing on trainer floor seat, and when I switched to adult toilet, he stopped. I'm not sure I totally understand the question. But it sounds like if he's not, I'm wondering if you're asking if he's not peeing in the adult potty. I wonder if he's a little anxious. I wonder if you can use a seat insert with foot support in order to make it feel a little less kind of overwhelming. And if I misunderstood, please go ahead and clarify in the chat, or people are welcome to unmute themselves as well if I happen to read something that is yours. So Anne have a stubborn son who holds it all day at school. They take him 5 times a day and he pees immediately when he gets home. I take him when we get home, but he won't do it unless he's in his diaper. Suggestions. So it sounds like you guys are in kind of the earlier stages of toileting. I would say maybe taking a step back and doing the data tracking just to see how long your son is holding it, and being able to kind of have a higher likelihood of catching him when he has a full bladder versus not. With regard to only wanting to go in his diaper, the thing that I would say is can we start with desensitizing to going in the diaper, but while sitting on the toilet, right? So the lid, you can put the lid down and have your child sit on the toilet, pee there, right? And then, or even standing in the bathroom. And then we can work our way to like removing the diaper and sitting and actually producing something in the toilet. But it sounds like maybe at school, if they're taking him 5 times a day, that maybe we're just not catching him when his bladder is full. And so I would say maybe going back to that data tracking piece that might be helpful. He will go with warm water, but that's it. We have the stool for seating. Okay, so this was a follow-up from Anne that he will go with warm water. Some of our kids actually, I would say that that's actually quite common where the sensation is not it's like a physical lack of self-awareness, and that the warm water actually then results in urine happening. I have actually someone who has a dual diagnosis who's probably in his 20s now, but when he was a young adult, when he was in his teens, so like 17 or 18, his mom would actually have to put a washcloth on his leg, a warm washcloth on his leg to get him to pee. And then I had another family who would actually use a spray bottle with warm water in it. So I'm wondering if that's kind of a sensory component, and maybe talking to an occupational therapist to see if they have some suggestions on how to kind of help increase that awareness. They oftentimes will have really great strategies. I appreciate the advice we have next year. Would the best approach for school be to let them know the time tracking and let them know what time she normally goes to the bathroom? Yes, I think that. So Sarah, going back to your question about the school, yes, I would think that I'm a fan of kind of a collaborative approach. So I would say here are the times that she normally goes to the bathroom, and then maybe saying like, how can we kind of finagle that same time frame for school? Like what works with your schedule, just so that it feels like that they're being collaborative around that, and then they can say like what their staff availability is, because we want to make sure that there's a high likelihood that we can successfully actually do this. I was wondering, in connection to Maria's question, is there concern that the child will get used to the floor potty and have a hard time transitioning to the big potty? Is it best to just start in the big potty? It depends. I wouldn't necessarily say every child has a hard time transitioning from the floor potty to the big potty. I think sometimes if they are having a hard time, it's usually related to fear of kind of falling in or something like that. So they have potty seats where they're actually transitional seats too. So it's a floor potty, and then you can actually just take the top off and then stick it on a big potty so that that part still looks the same. So I would actually say that that could be a good option. I don't consistently see that as being an issue, especially if the seat is stable and has like foot support or has a way for the child to climb up and feel stable. So I haven't seen that happen a ton. Um, do you have examples of small baby step goals in your book? We do have like, lots and lots of examples of, yeah, the smaller goals, but just to kind of articulate what some of those steps could be. Like I said, it could be, my goal is just, I know my child is very rigid in their schedule. So I am going to start taking them when they wake up in the morning and just before bed. That's absolutely an appropriate first step goal, and that if that feels manageable. So it's going to be different depending on who you are, because it really is going to depend on like what feels manageable, right? Like for some families, they're like, I'm going to totally start taking them 5 times a day. I'm going to encourage urinating every single time. We're going to sit on the potty for like 5 minutes, whatever it is. But that might not be feasible for the next person. So I really say, like, whatever the baby step is, it's something that you feel like you can be successful with. On top of that, we're not just looking at what can we be successful with, we're also looking at what are the child's skills. If the child has low tone and they don't have an awareness of when their bladder is full, we can't expect the child to be holding their bladder and then urinating consistently in the toilet right off the bat. So it's kind of like an unfair baby step if that's not, a skill that the child has. But if you took data and the child has the ability to hold their urine, then it's absolutely reasonable to say like, oh, they're peeing in the potty every single time I do that. So it's hard to kind of give lots and lots of baby steps, but what I would say is that it needs to be a goal that you can successfully implement, and a goal that you can successfully implement based on your child's skills. So if they're not, walking yet, you can't expect them to walk to the bathroom on their own, right? Like that's not going to work. So that's what I would encourage. What if your child won't use a step ladder to get onto the potty, but isn't tall enough to get on themselves? Afraid she is getting used to me setting her on the potty. Suggestions. I am such a huge fan of a team approach, and I would say, can you ask your PT, if you have a physical therapist working with you or an OT? PT makes more sense to work on stairs, and that just being a goal. And sometimes it can be just about like, how many steps are there? Are they steps that are like step stools that don't have like floating stairs? So so I would actually say that maybe it's a fear of kind of like the steps stool, because that's not a skill that the child has from a gross motor standpoint. And if that's the case, I would say, can we work on that in PT? It's okay for families. I mean, they might say, no, we're not there yet. And then we say, let's just keep putting, lifting and putting on the stool. Or can I do it assisted, right? So can I put them on the first step and then help them to kind of lift their leg so that they're starting to learn that process? So it's kind of like one of those things where is it a skill that they can develop quickly or not? And then we accommodate. Okay, those are all the questions in the chat. And lots of wonderful feedback. Thank you so much. It is such a big mountain to climb, and I really truly believe that it is something that our kids can be successful with. It's just that we have to get out of our heads that we're going to go from not being toilet trained to being fully potty trained and going on your own and not needing any support. Like, we have to get out of our heads that that's the goal that we're going to achieve in a very quick amount of time. We can keep making baby steps towards that bigger goal. And that's what's going to help us be successful and for our kids to feel really proud of themselves as well. So I think that that's really important to take into consideration. Does anybody else have questions? Please do feel free to use my email address if you, have questions that come up even after today. Like I said, I can't provide care across state lines, but I'm always happy. My kids, all the kids I've worked with have forced me to really maintain a level of curiosity and innovation to come up with new, unique ways of addressing some of the challenges that come up. So I feel like sometimes I can, if you share with me what your child's specific challenges, I can sometimes throw out some ideas just because of it. It's probably not, a one-time thing. It's probably something I have experienced. I can't guarantee it's going to work, but it's always a good starting point.
Well, thank you so much. We really appreciate it. This has been so helpful. So we appreciate your time and expertise.
Yes, anytime. So happy to be here and to share what I've learned.
All right. Well, thank you so much. And I'll send out the PowerPoint, the other document, and then a link to this recording.
Wonderful. Have a great rest of your day.
Thank you. Bye.